Hi, I'm Dr. Fraz, and I'd like to introduce myself to you. I have been a DVM since 2005, and right after vet school, I did a master's and then a PhD, both in small animal and exotic surgery. I have 25 published papers in orthopedic surgery. I have given over 150 lectures and week-long courses all around the globe on both exotics and small animal surgery. And I have been a member of and a faculty of AO Vet since 2010. Today, I want to talk to you about cranial cruciate rupture, which is the most common orthopedic reason we see dogs in practice today. The knee joint is held in place by many different ligaments, tendons, muscles, and the meniscus. The cranial cruciate ligament is probably the most important ligament in there, and it avoids that the knee slides forward. The disease of the cranial cruciate rupture is a little bit different than in humans because in humans, most of the times, it's a traumatic disease, so it happens acutely. In dogs, it is caused by a degeneration of the ligament. So when it ruptures, it's actually very sick and we cannot suture it back together majority of the times. Nobody knows exactly all of the causes that are related to this, but we know that obesity, poor physical condition, genetics, conformation of the bones, and configuration of the joint and breed are all related to a potential ligament rupture. And it is important to understand that between 40 to 60% of the dogs that have had a rupture on one knee will at some point develop a rupture on the other knee as well. It is not uncommon to see patients that come limping from one knee and the owner never realized that it had had a rupture on the other knee already at some point before. It's common in dogs that are really strong, very muscular, bigger dogs, that they will rupture the ligament and sometimes the owner won't even notice it because they compensate so well with their other ligaments and muscles and tendons. And it is very common that at some point, either before or even after surgery, that the meniscus suffers a rupture as well. Some of the signs that we see with the cranial cruciate disease is dogs will have a hard time rising up from laying down or sitting. They'll have a hard time jumping up on the car or furniture or climbing upstairs. They will avoid exercise many times. They sometimes will present with lameness. They can have muscle atrophy or a decreased muscle mass of the leg. They will have a decreased range of motion of that knee. Sometimes owners will notice a popping noise, which may indicate that there has been a meniscal tear. We can sometimes palpate a swelling of the inside of the knee, and that tells us that there is fibrosis in there or a scar tissue that shows that this has been a chronic type of tear. Some dogs will present with pain, sometimes they will not want to play, and sometimes they will present with stiffness as well. So for diagnosing this disease, the most important part is the clinical exam, where we will be able to palpate and notice a abnormal movement of the knee joint most of the times. Sometimes in really big and strong dogs, we need to sedate so we're able to feel this. In chronic disease, sometimes we cannot feel a very abnormal movement of the joint. And then x-rays are very important because they will let us see presence of joint effusion, which is a abnormal fluid accumulation inside of the joint. We will be able to evaluate the arthritis. We will be able to take measurements to plan for surgery. And we can also use them to rule out potential other diseases that could be happening. When it comes to treatment, there have been over 300 described surgical treatments for cranial cruciate ruptures. Sometimes owners opt to treat their dogs with NSAIDs and pain medications, and sometimes that's the only options if this is a very old dog or if there is some other disease that prevents us from doing surgery. You have to understand, though, that with medical treatment, osteoarthritis will progress quickly and will be a lifelong problem for the dog. When we do surgery, we try to slow down osteoarthritis as much as we can, but it will happen eventually to all dogs. It will happen eventually to all of us, actually. The best treatment is chosen based on the size of your dog, age, personality, and TPA, which stands for tibial plateau angle, which is a measurement that we do based on x-rays and will let us know what type of treatment your dog needs. The TPLO, or tibial plateau leveling osteotomy, is today the most used surgical procedure to treat the cranial cruciate rupture. It is also the gold standard for it for the majority of the times. Some cases need different types of treatments, but whenever we're able to do a TPLO, this is what we will do. It is basically, we will saw the bone, and I know this sounds terrifying, but we saw the bone and we move it to adjust the architecture of the joint. And when we do that, we will prevent the joint from sliding forward, and that will stabilize the joint in itself. No need to repair the ligament itself. When we do that, though, those two bone fragments are loose, and that is why we put a plate on the bone to hold everything in place. So the knee problem now is fixed, but now we have to wait for bone to heal. I always say that the hardest part of the treatment is the aftercare. So your job. After surgery, your dog is going to have to stay about 10 days in absolute rest, only going out for potty on a leash. They will be wearing these fun, cute post-surgical onesies though. But you have to remember that as soon as surgery is over, the ligament problem is solved, but now we have to wait for that bone to heal. And bone takes usually 3 to 6 months, sometimes even more than that, to heal. Your dog is not going to be in pain that long. They're not going to be feeling anything. They will walk normally, but still we have to remember that the bone will be healing and that plate needs to stay in place for that bone to heal. If your dog does too much too soon, the plate could break, the screws could break, and we have to be careful about that. So after those 10 days, what we're going to do is your dog will start on a slow, progressive increase in exercise. You can take them on a leash walk for about 5 minutes. And if they're doing fine, do that for a couple of days and increase it to 7 or 8 minutes. And they're doing fine, you can do 10 minutes. So slowly increase it. Soon enough, your dog is going to be feeling well enough that you will think everything is fine and you don't need to worry anymore. But it is important that they continue to be leash walked, because anytime until I see that the bone is healed on an x-ray, anytime the surgery could fail. So we have to be very careful with that. Another potential complication, it's uncommon, but another potential complication is an infection on the surgical site. So around the plate, near the bone, sometimes those infections can be treated by just oral antibiotics. Sometimes we need to go back in and collect a culture and then put the antibiotics right next to the bone. This is not common, but it's important that we know that it's a potential complication. If the plate breaks or the screw break, we would have to go back into surgery and do whatever we need to do to make sure it heals properly. But of course, nobody wants any of that to happen. So for us to make sure everything is progressing as expected, we need to take x-rays every 30 days after surgery. So up until I see bone healing, we will be seeing you again every 30 days to make sure it's healing properly. And throughout this time, No excessive exercises. So no chasing squirrels, no tossing a ball to your dog or going to the doggy park, not until bone is healed. I want you to know that my pets are also part of my family, and I understand this sometimes is a scary moment for families, but rest assured that we will treat your pet as we would treat our own. And our goal is to have your baby back home healthy and happy, living its best life as soon as we can. Thank you so much. And if you have any questions, please feel free to email me at faraz@dogwood.vet.